Hello, everyone. This is Dr. Yonit Arthur. I'm an audiologist and strength coach. You are on my channel, The Steady Coach. And today I'm going to be interviewing a special guest named John. So, John is a physiotherapist who lives in Sydney, Australia. And he completed his sports science degree from the Western Sydney University and got his master's at Sydney University. So, John's here to talk to us about his own experiences with chronic dizziness symptoms and also how he views that biopsychosocial model that I'm always talking about, relating both to chronic dizziness and pain. So, going to bring John in. Hi, John. Thank you so much for being here.
Hello everyone from
Hi.
Australia.
Yeah, hello from Australia. You guys, I'm not even going to tell you how long it took us to figure out the time zone stuff today.
Yeah,
It's amazing we managed to actually make it work, right?
yeah,
Yeah. Okay, so John, would you mind just telling us a little bit more about yourself so everyone can get to know you a bit?
yeah. Cool. So, yeah, I'm a physiotherapist, and I've been in the field for a few years now.
Mhm.
Um, and personal stuff.
Yeah, well, or,
Okay.
like your specialty. I know you work with older adults,
Oh,
right?
yeah, yeah.
Yeah?
That's right. So,
Yeah.
I've worked in so far in a few different areas of physiotherapy already. So, I started off in private practice.
Mhm.
Um, I actually got a gig out as a physio in the mines, and yeah, just saw a lot of sort of people um, in the big mining companies, things like that. So I
Mhm.
saw a lot of different um, injuries on the spectrum,
Mhm.
and that was quite intense. So there was a lot of work there.
I bet.
I have also worked in community aged care. So I've gone into people's homes, did physio for them there, and also in residential, so in the retirement homes or villages. Yeah,
Mhm. Yeah.
yeah,
So what's your kind of bread and butter right now? Like, what kinds of things are you treating and seeing every day?
yeah. So um, at the moment, there's a heavy emphasis on something called pain management, and there's a lot of funding for it in
Mhm.
Australia at the moment. And so that would be the main one, and just maintaining the mobility for the elderly as well is a huge one. So like exercise based
Mhm. Yeah.
treatments.
Yeah, and well, and y- so John, you found me through my channel and
Yeah,
wrote to me on my channel, and that's how we connected. So
yeah.
I know that you're going to have a lot to say about pain.
Oh, definitely. Yeah,
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 because
yeah,
chronic pain and chronic dizziness are highly
yeah,
related. So I'm super
yeah,
excited to hear because I think you have, as you've mentioned and as we chatted about before we started recording,
yeah,
you have a particular set of views that neuroplasticity or helping people with neuroplastic conditions like pain and
yeah,
dizziness aren't necessarily something that people can treat in a passive way, like that
yeah.
someone's a patient and then they get a pill or they get a bit of acupuncture and boom, they're better. There's much more to it than that, right?
Yes,
Yeah.
definitely. Yeah.
So before we get into that though, I'd love to hear more about what you've been through. You so
Yeah.
what brought you to my channel when you first found me?
Yeah, so um I I think I'd be much like everybody else who is experiencing triple PD. This sort of dizziness just sort of gradually came out of nowhere, sort of at the beginning of the year. Um, yeah, I it wasn't really like a sensation where like the room was spinning like vertigo or anything like that. It was just more like a unsteady, sort of hazy, woozy feeling, like when you're a little under the influence or something like that. And I just knew something wasn't quite normal there. And it was, yeah, it was beginning to worry me a lot. I I thought, in the first week, this would just pass, but it just wouldn't go away. And as time went on, like I got more and more worried trying to find answers. So, I was seeing, the GP regularly to
Mhm.
get answers. We got a blood test done just to see like um, everything. So all my vitamin levels, iron,
Mhm.
things like that. Everything came back fine. Um, yeah, and then it even got to the point where I was so worried that I went to ED. just
Wow.
I just wanted to
Yeah.
know because I was feeling pretty off and worried, and like I knew that um they would do blood tests there as well, and basically the one of the doctors was like, look, we're happy to get your brain scan. So I got a brain scan. I saw the neurologist. Everything was fine. And so I just kept trying to get answers. It was such a long, sort of stressful process
Mhm.
with a lot of anxiety. And of course, like looking up the internet's all part of
Oh, yeah.
the journey. So
Oh, yeah.
um,
You've got a brain tumor, you've got multiple sclerosis, you've got right?
yeah.
Yeah.
And the thing is like dizziness is such a like non-specific sort of symptom. So you could Google it and you'll get everything under the
Mhm.
sun, like diabetes or
Mhm.
dehydration, whatever. And so like it took me a while to find triple PD, but I just had a look at triple PD and the diagnostic criteria, and I was like, oh, that kind of like looks like what I have because like I had this dizziness for like 3 months plus. All my other medical sort of results were cleared.
Mhm.
And yeah, like I found your channel on YouTube, and honestly, I felt like that was the place where I got the most answers by far. And I did the free sort of course that you offer,
Mhm.
and yeah, I noticed I was coping a lot better from then. So yeah,
Mhm.
I'm still a work in progress. Like I
Mhm.
still feel sort of the sensations, but I'm just living life normally. Like,
Mhm.
so yeah,
Yeah. Yeah. So let's is it okay if we dig into kind of what your experience was a little more
yeah,
since
yeah,
I
sure,
know people watching and I'm sure you notice this as well.
yeah,
Feeling seen is such a big part of getting better, like feeling like, "Oh my gosh, I'm not alone. I'm not crazy. I'm not just
yeah,
anxious." Just
yeah,
because there aren't medical answers doesn't mean someone else isn't going through it too.
yeah, yeah,
So so can you so you said it started in January and
yeah,
when things were at their peak and you were like feeling really bad, what
yeah.
was daily life like for you?
Oh, so um, at that point in time, around in yeah, late January, I freaked out. I yeah, I took off work, and I took off a lot of work.
Mm.
Um, but fortunately, I'm sort of like a contractor, so
Mhm.
that wasn't too bad. But I, at my worst, I was just just lying in bed trying to rest up, and I was freaking out, and yeah, I remember even not going to the gym.
Mhm.
I was just thinking to myself, oh, like I wouldn't want to go. I don't feel confident to go to the gym. Like I feel like unsteady and out of balance and things like that. So
Mhm.
it was like, yeah, it was like a very unsettling feeling that kind of stopped me from just living a normal life at that
Mhm.
time.
Mhm.
But yeah, with my like physio background and everything, I really at that time, and this is before I even came across your course, like I bought like a pair of kettlebells
Mhm.
just to put in the home,
Mhm.
and I was kind of just trying to prescribe myself vestibular type balance exercises, and
Mhm.
yeah, I was doing a lot of that, so that kind of helped me get my confidence like pretty quickly.
Mhm.
So I kind of snapped out of that mode like fairly quickly. So, but I do remember that for like a week, I was just not very confident, not doing the normal things in
Mhm.
life, like yeah, not working, things like that.
Yeah.
Yeah,
Gosh, and you can see, I mean, I'm sure you can really see how for someone who didn't have your background, who
yeah,
was like an accountant or a lawyer or
yeah,
any other profession, who didn't understand kind of how exercise and movement affects our body and our brains, you could have
yeah.
totally just stayed in bed.
Definitely, definitely. I was really, really frightened. Um,
Yeah.
and yeah, I could definitely see how, yeah, like, um, yeah,
Yeah.
I could
Yeah.
empathize. Yeah,
Yeah. So you credit kind of the getting up, getting moving to kind of at least pulling you out of the depths of that experience. But
yeah,
then you still just felt like, gosh, I need some answers. I need a diagnosis. I need to know
yeah,
like a treatment plan, right?
yeah. So, I had like an event last year where I went to ED. I was severely
Emergency
anemic.
room for people who
And
don't know. Yeah.
oh yeah,
Yeah.
yeah,
Yeah.
emergency department, emergency room. Yeah, so I was severely anemic, and I didn't know at the time because like I was seeing the GP because I just felt really fatigued back then, um, and they didn't really say anything. They didn't really get me to do a blood test even. So I went to ED and I got my bloods done and um, my hemoglobin was super low and I had to get a blood and iron transfusion.
Wow.
And yeah, I think from that experience, it kind of developed this sort of um, this like feeling that I need to like really push for answers because like back at that time I wasn't for so many months I didn't get the answers until I was really really sick
Hmm.
and struggled to like do normal things because I was anemic. So that kind of carried on to this incident and it would like frighten me even more that I wasn't getting answers no matter how much I was asking for things and I even got to the point where I saw three different GPs because we all have that narrative like just see another one and
Hmm.
like two of them are just like look we don't know what the first one was like we don't know what it is
Hmm.
sorry like everything's we checked your ears we checked your your bloods and everything the second one was just like yeah we don't know but it's probably anxiety so um that was that and then so I remember this would have been like 3 months later. Um, I decided to myself, like, I don't want to keep, like being on this chase and freaking out. And I think that's when like found out about triple PD. Yeah,
Hmm.
so I found out about triple PD, and I heard that there was a good GP in town, and I was like, this is the last GP I'm going to go to. I gave him everything and he was honest with me. He was like, I don't know what it is. He's like, I don't know what triple PD is, but
Oh gosh.
yeah, I just thought to myself, look, I have a bit of a medical background myself, so um, I'm just gonna stop worrying and just triple PD and go from there. So
Yeah, well, there's a lot to unpack in what you just said. I have so many things to say.
okay,
So, just kind of because you just said this, I'm gonna work my way backwards, but
yeah,
I just think about all the people who you've seen in your career, I've seen in my career,
yeah,
and how many of them without that medical background would be thrown into like just more of the depths by hearing those kinds of answers. And
yeah,
thank goodness for you on your for you that you had that enough background to be like, okay, well, I'm just gonna go with the diagnosis that I think is okay, and to hell with you guys. Like most people just
yeah,
are so scared to do that. We're all brought up in such a biomedical society where we're like,
yeah,
okay, well, you're the expert on me. So like
yeah,
you have to give me the answer,
yeah.
right?
Definitely. I'll throw out something, um, just to sort of go along with that sentiment. Like, so, and I know that we'll go more into this later in the chat, but like as a physiotherapist, with my understanding of conditions and the evidence based sort of studies behind it, like there is a vast majority of conditions that have natural healing as a component. And so I see a lot of, like patients, and we even studied this in university as well. Like there's a lot of fear driven behavior. And, you know, like I say to a lot of my family and friends, I just sort of reassure them. I just say, like, you're fine. Like, you will be fine. And so I guess the reason why I bring that up in relation to what I was speaking about is because it's like I have that understanding that, um yeah, like whatever this is that I have going on, um yeah, it might not just be this case of I have something and I need to fix it. It's really just like, the body's amazing. It adapts. It can heal like on its own a lot of the times. Bar if it's like something really serious, like, but my brain scan didn't show anything serious like a tumor or anything like that. So I was able to have that confidence with
Mhm.
my sort of knowledge of medical conditions.
Oh,
Yeah. So
I just whoever is listening, rewind and listen to that again, please. Because
yeah,
your body is perfectly capable of natural healing in most, like for most things. For
yeah,
most things. It's just that we Google and like physicians are always looking for like the big rare thing that they can excise with surgery or
yeah,
the big medicine that's going to fix it. But that's because that's how they're trained. But it's not necessarily the best path to getting better. It's not.
yeah. I just
Yeah.
want to throw in a quick one there as well. Like it would amaze me, like when I was studying, we'd just be going through all these different conditions, like medical conditions like diabetes, stroke, cancer, things like that. And just like exercise and diet would just by and far be the most effective treatments for these
Mhm.
sort of conditions. It's like, yeah, so the power of just,
Moving.
like exercise, moving, like healthy diet coupled with natural healing is really like, yeah, the evidence is really leaning towards that
Oh, we are
nowadays.
gonna get into that in a second.
Yeah,
I yes, um, big time, and we're gonna kinda talk about I'll be asking you some questions in a few minutes about
sure.
what movement has to do with neuroplasticity and why
Yeah,
I mean, I guess on the same token, like, why dizziness is so particularly insidious, like, because
yeah,
people stop moving because they're
yeah,
dizzy, and that's exactly the thing that can actually make them better. So,
yeah, yeah.
we'll talk about that, but I wanna just
Cool. Yeah,
mention one thing that you talked about a few minutes ago. So, what I have found, strangely, but maybe not so strangely, is that large number of people that I see who have triple PD have had some kind of major health scare
mm,
before.
yeah,
And it's not all of them, but it's a very significant number of people. So I've had clients who've shown up, with chronic dizziness who had emergency surgery 2 years before, or
yeah,
who almost died from complications from some other illness a few years
yeah,
ago. And I think that sets your brain up for hypervigilance.
yeah,
So when you have a maybe not so much an innocuous feeling, but when
yeah,
you wake up one morning and you're dizzy, which by the way could happen to anyone, anytime.
yeah,
You don't have to have a vestibular condition. Sometimes your body's just off.
yeah,
Sometimes you have a virus that messes with your ear. Sometimes you have a cold or a sinus infection. It's not always something nefarious like that's
yeah,
trying to really get you and it's going to make you dizzy forever. But when your brain is already kind of in that state, like, I can't trust the doctors,
yeah,
I have to really be vigilant about what's happening to my body because otherwise I could die. And it's literally happened to you before that actually came to pass.
yeah,
You're much more likely to go into that mode and stay in that fight or flight mode and then stay dizzy.
yeah, yeah.
So I'm so happy that you mentioned that had happened to you because I think that, again, that's something that is going to resonate with lots of people watching.
Yeah, so um yeah, when I was severely anemic, I mean my hemoglobin was like 50, so the doctor's really surprised. Like I was basically a walking zombie.
Oh my gosh.
Yeah, so like that was a major scare for me, and also just like your course really focuses on like the like emotional components, the mental components, and like looking back, like I went through really sort of like life changing, stressful situations for me, like
Yeah.
personal things. So,
Yeah. Beyond
yeah,
that? Beyond the anemia or just or specifically the anemia?
oh no, so I was saying like the anemia was very
Life-changing. Yeah.
well. Oh no, what I meant was the anemia was like a frightening event that happened, but also I was also going through a lot of other stressful things, like aside from the anemia as well.
Mhm.
Um, that I didn't really think was significant until I sort of like what did your course, because you mentioned like highly stressful situations can like um yeah contribute to the chronic dizziness, and I was like I kind of underestimated like all this emotional turmoil I was going through
Mm,
back then. So
yeah.
yeah, I just thought I'd quickly mention that as
Yeah, and you're welcome to go into more detail if you'd like, or if you wanna just kinda leave it
well.
with the term emotional turmoil, that's up to you. I'm sure people
Yeah,
would love to
sure.
hear all the things that have happened to you if you wanna share.
Yeah, okay, yeah,
Yeah.
yeah,
So, um, okay, so you kind of agree that may have just set your brain up with all the stuff you were going on that was going
yeah,
on at the time, including the anemia, all
yeah,
kinda set you up later on to be like, "What the hell is this?" when the dizziness symptoms kicked on.
yeah, yeah,
Yeah.
yeah,
Okay.
definitely, yeah,
So what's changed now? So you mentioned you're a lot less afraid of the symptoms, you're living your life. So what's
yeah.
changed? What else has changed since January?
From now, whew, so in terms of my recovery, or like,
Mhm.
oh yeah, so like I'm just living a normal life now. um, like I go to work. Um, I'm so much more in tune with my body, and like just I can actually like it's a night and day difference, because now I can realize my dizziness comes on more when I'm like emotionally bothered, or
Isn't that
like
interesting?
yeah, and it's like it's clearer and clearer and clearer, because like I can pick out now. I'm at the stage where I can pick out like when something bothers me that kind of like hits my sort of deeper issues,
Mhm.
and it's like I'm really dizzy, and then it's like I'm not as dizzy like all the other times. So I have this like constant level of, that sort of dizziness, but it doesn't really bother me or anything like that for most of the time. And so, yeah, I go to work, I go to the gym, and like I've been pushing, I try to like push it from like a vestibular standpoint in a way, if you could call it. But like,
Mhm.
I love to play basketball, so yeah, like I'll go out and play basketball even, or tennis, things that are more like challenging. And yeah, I might feel like a little off, but it gives me that confidence, because I'm like, wow, I can play a sport even. So, um, and yeah, I think I'm ultimately just living normally. And in a lot of ways, I could even argue that my symptoms are, I mean, quite similar to how it was when I felt like it was at its peak.
Mhm.
Like, so I don't know if that's going to give comfort to people, like, in the sense that I feel like my symptoms are kind of the same, but like, it's like it's just the way that I deal with them is so much different. So it's kind of like I look back when I was um, just like lying in bed and not really wanting to go to the gym or anything. And to be honest, I think those symptoms wouldn't be too far off from what they are now.
Mhm.
It's just that I was really worried and frightened that it kind of made me feel that way. Now, I do think I my symptoms have gotten better because in the sense that I've got it under control. And I guess those moments where I feel it come on really strongly, like they've reduced, I guess,
Mhm.
more. But yeah, like that baseline sense of dizziness, like it's not too far off. And I
Mhm.
just changed the way that I looked at them
Mhm.
ultimately. Yeah.
Yeah. Yeah. Well, and I tell people there are two trajectories to healing or multiple trajectories to healing. There's the symptoms, so we ultimately want the symptoms to come down. That's good.
Yeah.
But there's also kind of this personal growth dealing with life trajectory, and
Yeah.
sometimes they don't happen in parallel. I mean, they're both happening, but sometimes you kind of pull ahead, you feel better, you're coping with things better, you feel better about your life, and the symptoms still linger for a little longer, but that doesn't mean that they're not going to go away. It just means that your brain is still dealing with it, it's still working on it.
Yeah. Yeah.
So let me ask you, because I think people are going to want to know your thoughts. So do you think that as you continue to work on these things that your symptoms are going to go away or get better?
Yeah, look, that's a huge challenge. Like, um, I struggle with that. I
Hmm.
do. Like, um, I mean, on a conscious level, I have a hope that
Hmm.
I will.
Hmm.
And um, but like, yeah, I get those doubts. Like,
Hmm.
how long is this gonna go for? Like,
Hmm.
why do I have this? I get upset about it.
Hmm.
But I think now more than ever, I'm like really okay with it.
Yeah.
Just in fact, I look back on my life and I look back on how I coped with, you know, stressful situations, handled emotional things. And I feel like more than ever, I'm equipped to handle these things and sort of stay on top of my fight or flight system
Hmm.
because that, as you say, has such a huge impact on our health physically.
Hmm.
And that gives me assurance that, like, someday, the dizziness will go away, but I will have come out so much better for it because I've got all the tools that
Hmm.
I can to, because like life is like super stressful. Like, and I'll just bring this up because like it's something a counselor said. So I've been also seeing
Good
a
for you.
counselor too.
Yeah.
But we live in a day and age now where like it's more complex than just going out and trying to find some food, like
Right.
hunting animals for some food. It's like we worry about our career, our families, what people think about us on social media, like all these things that put us into the fight or flight. It makes our minds geared towards the future and past without really just staying in the present. And yeah, I feel like all the things I've picked up like are helping me deal with like our modern day. And I truly believe like triple PD is like a growing condition, like,
It
and
is.
it'll affect more and more people because we're set up in this type of environment that really like triggers our fight or flight
Hmm.
like so easily. So yeah.
Yeah. Well, you said so much there that was valuable. So I want people to understand. I mean, one of the reasons I'm starting to do interviews this way is because I want to talk to people who are in the process. That I think this idea that there's this finish line, like where recovery is complete. Um,
Yeah,
recovery is complete. You have no sensations in your body ever. Like that's
yeah,
just not a realistic, like
yeah,
uh, that shouldn't be the goal line, right? So
yeah,
it's always going to be a process like what you're going through. But you're also, I mean, I know 6 months is a long time, but I know, but the quality of life you're living right now is very, very good.
Yeah,
And you're 6 months in, and sometimes this kind of thing takes a little bit longer. You mentioned you're
yeah,
still also going through some personal growth things and
yeah.
figuring some stuff out. And I'm confident that as you work through those things, the actual sensations are going to go away too. But ultimately, I'll take this, what you're living, like the way you're living right now, I'll take this and say this is much, much better than it was before.
Oh, definitely. It's like I have I guess the course has helped me like have patience and confidence in my life and not to see the condition as like something that's hampering me, but something I can use to my advantage.
Mhm,
Like I was also gonna say on that note as well, like as a physio, like I've seen like so many conditions that take a long time. Like for example, like plantar fasciitis or like any tendinopathy or
mhm,
tendonitis
mhm,
issues like golfer's elbow
mhm.
or tennis elbow, meniscus injuries. These things
They
can
take
take
time.
like a year or two, or like chronic lower back pain patients. And, um, there's always like um, a multi-dimensional sort of factors that are in play. And I think it's the main thing is like to treat it as like reassurance and just kind of like working through things with the condition that you have,
Mhm,
if that makes sense.
mhm. And knowing that things will change inevitably. I mean,
Yeah,
invariably, whether we want them to or not, they do change, but
yeah,
that healing can take some time, and that's okay.
definitely. Yeah,
And
yeah,
it doesn't mean you have to
yeah,
live life in bed or be terrified of every day anymore. It means that
yeah,
the sensations may hang around for a while, but you can live a normal life at the same time and
yeah,
continue to work for healing.
yeah, yeah.
Yeah, I love it. I love it. That's such a great message. So, I mean, so you were just touching on this. So, I'm I was so excited to talk to you partly because you're not just someone who's been through this, but also you have all this training and all this knowledge in pain. So, um, when you watched my videos and you did the course, I think you mentioned that it made you think, "Oh, this is starting to sound a little bit like pain."
Mm.
Right? So can you go into that a little bit, kind of that biopsychosocial model of pain and what that means for people who haven't heard about it?
Right, right. So, this is something that the biopsychosocial model was something really emphasized on in my studies
Mhm,
at university. So, yeah, I'm a fairly young clinician, so like my studies are recent and they're really like yeah, physiotherapy is going through like quite a big change
mhm,
lately, and it's moving away from what we call like the biomedical model, which is basically defined as like the absence of illness is health. So,
mhm,
but it's like it's changing from that because what we know now is like conditions are multifactorial. You got to consider someone's environment, their psychology, the support they're getting, their mental health, things like that. Um, so yeah. So wait, sorry. Going
yeah,
back to the question
yeah.
about pain.
Oh, no, go on as much as you want to about the biopsychosocial model. Go off on tangents. It's good. This is good stuff for people to hear.
Yeah,
Yeah.
yeah. So basically, that's kind of changed ultimately the way that like as physical therapists, physiotherapists, we want to like treat these conditions. So for instance, like someone with lower back pain, like in the past it would have been like, okay, they've got lower back pain, so just give them like a massage or dry needling, and it will fix them.
Mhm,
But what we know now is like um there's like these huge other like factors like psychology. Now people with lower back pain, they will present with a lot of fear with movement and fear of the fact that they have these episodes of lower back pain, right? So a big part of our treatment using the biopsychosocial model is reassurance. And oftentimes we will refer to a psychologist. Now, this is a tricky one because we don't want people to feel like it's all in your head and
Right.
yeah,
But
just
it's
go to a
not.
psychologist. But we
Yeah.
actually went through the science of the psychology, because with our neural nervous system, right? So the best way I can explain it is like if you touch something hot, right? You That's the stimuli. So you'll feel the heat. It'll travel up. You'll have these receptors that receive the signal that the stove is hot. So these messages will travel up to your spine and then up into your brain, and then your brain processes, oh, this is hot, and then it will send back signals to your what we call the peripheral, and you will move your hand away. So what what the science is showing is that like with a lot of pain, there's actual like sort of things going on in that pain signaling pathway. Um, and oftentimes with chronic conditions, like these pathways are getting a little meddled with. And so if you have chronic pain, it's like these pathways are like there's a bit of things going on. So it will highlight that pain
Hmm.
from that sort of neural, even though your actual like physical impairments might not be as bad as what they are, the pain pathways will be like provoked, and you can make that worse by fear, by feeling scared.
Hmm.
So like reassurance is actually scientifically like a really big part of
Yeah.
counteracting that.
And people with chronic dizziness often don't get that at all. At all.
Right.
They get
Yeah.
nothing but like fear mongering, like, oh, well, you must have some horrible condition. You're just anxious. It's all in your head. And it's not.
Yeah.
The way I view chronic dizziness is the same way you just described chronic pain. It's a
Yeah.
what I would call, I'm going to use a fancy term I don't usually use on my channel, but we're we're getting fancy today. So central sensitization. So
Yeah.
this idea that your brain has kind of a giant volume control
Yeah.
that handles incoming information, and
Yeah.
when you're full of fear over something, it turns the volume up because it's like, this is
Yeah.
dangerous, we need to
Yeah.
focus on this. So you're
Yeah.
saying the same thing happens with pain.
Definitely.
Yeah.
Yeah.
Yeah. So what was that like to you, as like just kind of personally or professionally, to go through my course and be like, "Oh my gosh, my symptoms, they're just different symptoms, but it's the same general idea." What was that like for you?
So sorry, repeat that last bit
Yeah.
again, sorry?
Yeah. So when you went through my
Yeah.
course and you
Yeah.
were like, "Oh my gosh, she's just saying the same thing that
Yeah.
I tell my own patients about pain."
Right.
Was
Yeah.
that like a big revelation to you? What was that like
Well,
when you
yeah,
realized that?
it it made sense to me.
Mhm.
It made a lot of sense. And I actually felt like I trusted the advice that you gave in your program, and
Mhm.
I had a lot more faith in like how that would play into my recovery, as opposed to seeing something on Google that said like
Right.
I don't know, take this supplement or
Yeah.
like do this or that, which I'm sure like these things help, but you've also explained in your course like these things kind of like they're just aids, but they're not like the root of the condition.
Mhm.
And ultimately, that's the way I feel with pain and in terms of physio. Like a lot of the times, the massages, the dry needling, um, and this can be quite controversial, but like a lot of the evidence is showing that they don't make nearly as much of a difference um, to recovery.
Mhm.
Um, Now, sure, you'll feel good, and there's science behind a massage, for example, soft tissue release, like changing your pain pathways. But like in terms of function, strength, the important indicators of recovery,
Mhm.
like very minimal. And like exercise, movement, those type of things are showing like really strong evidence for recovery. So yeah, like I felt like going back to the point, like I could trust the advice of what from your sort of more biopsychosocial standpoint of
Mhm.
recovery for sure.
Yeah. That's and again, I think it goes back to kind of what you were saying about how reassurance really helps people.
Yeah,
That must have been reassuring to you personally, like
yeah,
to look at it and be like, "Oh, okay, I know this stuff. I know this stuff.
yeah,
Okay, so if she says this and I know this to like actually this lines up with what I know, okay, I can get better. I can do better."
yeah,
Right?
yeah,
But not everyone's been exposed to it in the way that you have.
yeah, right. Yeah,
Yeah. So, but I love how you explained how you explained this is a very fine line for people trying to explain it's not all in your head. Everything is in your head. All experiences, whether it's because you touched a hot stove or because your brain's perpetuating a pain signal,
yeah,
it's always happening in your nervous system. I tell
yeah,
people you don't feel pain or dizziness in your body. I mean, you feel it, we sense it in our body, but
yeah,
it's the brain that decides ultimately. The brain has to give its opinion, and
yeah,
pain or dizziness is an opinion of the brain.
yeah,
Yeah.
definitely.
So what do you think, just kind of wrapping up that bit, what do
Yeah,
you think is important for people with dizziness to know? Kind of from from your perspective as someone who's been through it and
yeah.
as a physical therapist.
Well, yeah, I think just and it kind of sums up what we were talking about with the biopsychosocial, but like I guess having this idea that like what's healthy is an absence of illness, like the biomedical, like, oh, I'm not dizzy, so this is working, like this is good. Like sometimes it doesn't work like that. Like I'll give an example of like tendinopathy or tendonitis.
Hmm.
Golfer's elbow, you start getting sore at the tendon, right?
Hmm.
Someone who's playing excessive golf or just overusing that
Hmm.
flexor muscle.
Hmm.
Um, that's not going to go away immediately. Like most times, it's going to be sore for a reason because that tendon's been overworked, that muscle's been overused,
Hmm.
and yeah, healing's going to take time. You got to kind of do things to change up your environment or change up how much your activities, things like that, and also like be patient with it as well, and not like it's not going to help if you're gonna like threat about it, and so from that standpoint, like yeah, I see that it's
Patience.
important. Yeah, the patience
Yeah.
is important. Um, yeah, so and so can you reframe that question again?
Yeah.
Yeah,
Yeah. So I was just wondering if you had any further like insights on how people should think about the dizziness, but I think you summed it up. I mean, unless you have something else to add,
yeah,
seems like what you're saying ultimately is remember that this is not all biomedical. So this is not all because of some kind of thing that
yeah,
happened to your body. In fact, for you,
yeah,
there was no thing that anyone was ever able to identify. And be patient because it takes your body and brain some time
yeah.
to heal.
Yeah, and from a physical therapist standpoint, like you can have so much confidence in your anatomy, your body as well. So I think my personal view with the exercises is like they help in the sense that they give you confidence
Confidence. Yes.
to be moving, and um, as you build that confidence, like you're turning off the alarm signals, like the threat response. So if you know you're going down the stairs is triggering that, like you practice like progressively like those movements, and I mean like yeah, so for me personally, like I got the kettlebells because I was in a safe space at home. I didn't have to go out to the gym when I was scared to go there, but I would be doing all these different movement patterns that picked up my confidence. I was like, oh, I can balance on one leg and do like a single leg deadlift, with the kettlebell. And then I'd do some hops like side
Mhm.
to side, and I'd be like, well, I can do hops, and I'm not bothered, I'm not falling down, and pick up my confidence from there like that. So yeah, like having confidence in the body that we have um, is another
That's
huge one.
huge. That's awesome, and I'm so glad you brought that up. And I'm totally going to ask you more about exercise in a second because I bet you have more to say about that. But that's kind of how I try to present this to people with the vestibular therapy. It's
Yeah,
it's not that your brain isn't capable of healing or you need some kind of special thing and this is going to fix you. It's that it
yeah,
restores confidence and reduces the, again, it's specifically for chronic dizziness. I wouldn't say this is
yeah.
true for acute vestibular injuries. That's something different.
Right,
But
right.
but for chronic dizziness, it turns up your confidence, which turns down your fear signal, which ultimately turns the volume control on the dizziness down.
Yeah, yeah,
Yeah. Yeah.
definitely. Um, and yeah, like I'd say the last point I'd have is like just yeah, being in tune with your body as well. So like being aware of like what what you're feeling, like with your emotions and things like that. Like your course touches a lot on that. And there's those little videos like the dizziness video and the somatic breathing one.
Mhm.
All those things are really good because it can help you sort of be in tune with your body as well and going through things. So yeah,
Yeah. Those are good pieces of advice. I hope people are writing this down. I mean, there's nothing that that we don't talk about elsewhere, in the course and the channel, but again,
yeah,
you've been through it and
yeah.
you're physio. So,
Yeah. Can I also just say this is another tangent as well, but
yeah.
like um you had a video, forget the title, but it was like talking about um don't do this, do this. Don't
Yes.
do this. So it was just
Yes.
like
Yes.
um
Yes.
diet supplements or something. Don't do that and yeah,
Yes.
do this. Look at the emotional things underlying your and like something there like really stood out to me where you talked about like things that you feel split with, like
Conflicts.
conflicts.
Hmm.
Um, and I realized over the months, those were the things that were triggering my dizziness. Every time because like, I haven't really gone into detail, I guess, about like my personal, like stressful life events, but um, I have a lot of people around me that have like different views. So getting a bit personal here, like I went through a time where I sort of like abandoned my religious beliefs, but that was a very big event for me because you grow up with very sort of rigid views, like a set of views on life, and that was very conflicting for me because I have family and friends around me who believe it,
Hmm.
um, and so like I noticed that every time I felt like I had an incidents where I'd be talking to someone or I would feel like that conflict because of differing views, like it just really set off that dizziness, and I'd walk away and I'd be like, wow, like that's crazy that it's so specific, like to this sort of thing, and yeah, so
It's wild when you see it in action. And
yeah,
people don't believe me when they first hear it. They're like,
uh,
there's no way that my feelings have anything to do with what I'm experiencing in my
yeah,
body. No way.
yeah,
Like they don't, and I'm like, have you heard, do you know what the word feeling mean? Like feeling in your body, like these things
yeah,
are related.
yeah,
But you're pointing out that even if it can't be easily resolved, like what you describe, having you know, a deep conflict with members of your family, it's not something that's just going to, poof, go away and
yeah,
everything's going to be great. It takes time to kind of work through these things, but what you notice is the awareness that that is actually the cause or a big contributor to the symptoms,
yeah,
again, turns that fear signal down. It turns the volume down. Like, okay,
yeah.
I see it. Okay, I may not be able to fix it, but it's contributing.
Yeah, yeah,
Yeah. And that's a question I get a lot on my channel, and I it's so hard to answer. People are like, "Well, okay, so I found the emotional conflicts. How do I fix them?" You know, right?
yeah,
And
yeah,
I'm like, "Well, here's the good news. Um, The good news is you don't have to fix them. You just need to be aware that they're happening and it is going to help you with your dizziness.
Yeah. Yeah.
Yeah. Okay, so before we finish, I have another question for you because I'm super curious to know what you'll say.
Yeah.
And as you know, I also have a background in exercise and
Mhm.
strength coaching and stuff like that beyond vestibular therapy. So, why do you think this is something you mentioned earlier that the research is showing exercise is better at helping people get better
Yeah.
from
Yeah.
pain and again, I would say dizziness as well than acupuncture, massage, and passive
Yeah.
modalities. So why do you think that is? Like, what's your opinion on that?
So with a, I think with a lot of these the conditions, musculoskeletal conditions, like
Mhm,
it's really like effective. Like I think it comes down to like a lot has to do with like increased blood flow
mhm,
through the so like if you have a joint injury,
mhm.
like blood flow will be really good, increased blood flow. And I think you get that when you get the massage or the dry needling, but like there's something about exercises that is like very natural and I like I'm putting my own perspectives here now, not
Yes,
necessarily
please.
things I've studied, but
Yeah.
like I would say it's more effective because you're using your own sort of movement into it. Not it's not passive, it's active. You're like using your central nervous system or your brain to like conduct that movement or like to
Mhm.
move your limb and get the blood flow through in there. And yeah, what else? Like yeah, like I mean, just the evidence is just so overwhelming for exercise because it like strengthens the ligaments,
Mhm.
the tendons, like every structure in
Yeah.
in the joint possible. So it really like it by and far surpasses like any sort of passive mode in the long run
Mhm.
for any condition like the ACL or anything like that.
Mhm.
So yeah, exercise is really like king for recovery in
Yeah.
that sense.
Well, and I have some, again, this is my perspective as a non-physio, but as an exercise person.
Yeah,
I feel like there are some key words in what you just said. I think there's a difference between being passive and active,
yeah,
both from the central nervous system perspective and the
yeah,
like agency perspective, like feeling like
yeah,
you're doing something that
yeah,
matters. Like
yeah,
that matters. Being a passive patient who's just being told, well, this is, we're just going to give you this pill and it's going to, this is what we're going to do. That's a very different experience from taking hold of whatever you're going through on your own and figuring it out. It just, I again, to me, it seems like the latter is more likely to yield like really major lasting changes in your life and in
yeah.
the way your brain processes information.
Definitely. If you have like yeah, take for example a patient with an ACL injury, right? And like you got physio A and physio B,
Hmm.
and A just gives them, passive modalities of treatment. So like the massages, dry needling for the whole duration of the 6 months. And then physio B is introducing progressive resistance exercise,
Hmm.
rehab exercises. Like person B, physio B, they're gonna get
Way
a
better.
totally different outcome, totally different outcome. And if I relate it personally to myself, I remember in the hardest stages of when I was dizzy, that the times when I was exercising, I felt the best. So this is like a personal anecdote,
Hmm.
but I felt the best when I was exercising. Now, granted, I wasn't like running around playing tennis or anything like that, but I was,
You're moving.
you know, I was moving. I had the kettlebells or the dumbbells or whatever band exercise at home, and I was working up a sweat. And I remember those times I felt the best. It kind of I got addicted. I was like, yeah, I felt really good.
Yeah,
So there's just
there
something
is.
about it. Like,
There
yeah,
is. There is. And thank you for again sharing more of your story because I think those personal anecdotes, this is what people want to hear too. I mean, we can
yeah,
cite 20 studies to them, but
yeah,
it's going to matter more to people to hear what you went through. So I'm
yeah.
glad you
And
shared. Yeah.
oh, sorry, just a quick another one as well. Like, I think at the worst stages, like I just wanted to have confidence that I wouldn't like fall or anything like that.
Hmm.
And yeah, like I would just keep reinforcing or like gaining that confidence. I'd be like, I'm doing some hops like side to side. I'm not falling down. Like I haven't had a fall once. Like there were times when I was at the shopping center and like I was feeling really dizzy in the shopping center.
Yeah.
And there was one time I like had to sit down, but I would say like yeah, I never had a fall. Fortunately for me, but I can attribute like exercise to really helping me have that confidence
Hmm.
to to get through any sort of yeah, I test myself when I do exercise to a point where like I have that confidence I can do anything. So
And
yeah,
that's a big part of getting better, just confidence in general. But
yeah,
there's something unique and special about accomplishing confidence, not just through journaling or just through emotional work, but also moving your body.
yeah, yeah,
Yeah, that's so I'm so glad you said that. And it's something I hope to be talking about on my channel a little bit more because it's something
yeah,
that's so important to me personally and also, but um I think it's just good to that we are stating that here that it does play that role. And I was also thinking, again, I this is my own personal theory, but there is some evidence and some theory out there about chronic pain that the some of the pain is caused by spasms and the spasms are due to reduced muscle flow. I mean muscle flow.
yeah,
Reduced blood flow, which I think that's pretty well understood. But
yeah,
the theory is that perhaps that fight or flight mode is contributing to that reduced blood flow. It's not it's the brain anticipating a problem that's reducing the blood flow. It's not just
yeah,
that there's muscle constriction or what have you.
yeah, yeah,
In which case exercise would help correctly rewire that. Exercise could serve as a neuroplastic
yeah,
stimulus. So it's rewiring your brain to actually stop reducing that blood flow. I
yeah,
promise I'm getting to my theory. I'm sorry. So,
yeah.
but so far, did anything I say not make sense, or is that kind of consistent with the general theory, one of the theories on why spasms and pain happen?
Yeah, definitely, definitely. And yeah, we definitely know that like exercise it can override that pain pathway
Hmm.
as
Yeah,
well as touch. So when you
yeah,
bang your head on the wall, like you'll automatically rub your head. So that's where like a massage, like or
can
dry
help.
needling can help. But
Right.
like yeah, exercise can also override that pain pathway, which is why in uni, like we were taught like would definitely prescribe exercise for someone with chronic pain.
Hmm.
Like it would be really silly to just tell them like no, like
Here, just take this pain
don't
pill.
move.
Yeah,
Yeah, or like avoid movement, avoid exercise. No, it's totally
it's the opposite.
contrary. It's the opposite.
Yeah.
If it's chronic lower back pain, anything like that, it's movement is best. Movement is key.
Love it.
Obviously, in like appropriate doses,
Right.
pain manageable, but
Mhm.
yeah,
Yeah.
definitely.
Yeah. So I'm so good. So far I'm not off the mark. That's awesome. So my theory
Yeah.
is that similar blood flow spasm type things can affect the vestibular system. So
Okay.
it,
Yeah.
what I again, I'm whether this is true or not, I'm not sure, I'm not sure, but it seems to be consistent with what I see
Yeah.
that fight flight mode again changes the flow of blood in our bodies and
Yeah.
it could potentially lead to reduced blood flow to parts of our body that are involved in our vestibular system, or that are involved in our balance system.
Yeah.
So one of the ways to combat this issue would be, of course, to address the fight flight mode, which I've talked about ad nauseum on my
Yeah.
channel. But the other way is to get the blood flowing and move.
Right. Yeah. Definitely. I think that's really interesting. I think there's so much more research that can be done with
Hmm.
triple PD. I believe, and you would know more about this, but like it's a fairly relatively recognized
Hmm.
medical condition.
Hmm.
And yeah, well, like what we know about, the vestibular system and like, yeah, like we've got these in terms of headaches and things, we have the nerves traveling up through the cervical, through
Hmm.
the neck to the brain. And like we know that like um I've seen people with like neck pain, but it's a lot of them come with like some type of headache or
Hmm.
things like that. And yeah, there definitely well could be like things happening, maybe like very yeah, like the soft tissue around their neck is very stiff,
Hmm.
or because like when we get stressed out, we can, like
We tighten up.
tighten up our muscles, and that can maybe affect sort of like the circuitry around there in some ways. So I definitely think like blood flow, um, yeah, like those things are happening
Hmm.
in our anatomy, and exercise is definitely the thing that's going to help promote that blood flow.
Yeah.
Yeah.
Awesome. Cool. Well, I'm glad that my theory isn't so crazy out there. I feel like it makes sense based on the things that I know. It's not I'm
Yeah.
I'm trained enough to know when I'm looking at a theory that's super kooky, but to me this makes a lot of sense. So
Yeah.
I had one more question for you that I think
Sure.
would be really helpful for people to hear from someone like you who like works with patients who are going
Yeah.
through stuff. So what I was wondering is if you had any advice for how people can advocate for themselves with a physio or with another medical professional. So if they're going through like chronic dizziness and they go see a vestibular therapist or a physiotherapist, how can they make sure they're getting support kind of in this biopsychosocial way? Like, how do they have a conversation about that with someone?
Yeah. That's
It's a
a
tough one because they can be touchy,
tough
right?
one. No, yeah, yeah, no. That's exactly what I was thinking, because I'll answer it this way. Like, um, I think, I mean, the reality is at this present time, I feel like there's not a whole lot that's been known about triple PD. Like in my personal experiences, like the three GPs had no idea, and even as a physiotherapist, like we are the experts. We know the anatomy very extensively out of anyone in the population, but we still haven't like we don't know all the answers. Like especially when it comes to vestibular, we're just really just trying our best in terms of what we might know ourselves. But I think like maybe just approaching health professionals with a kind of different expectation.
Mhm,
So rather than going in there and being like, hey, I need you to fix me, or like, maybe look at them as more like people that are going to support you in
mhm,
your journey. I mean, especially if it's dealing with chronic pain, chronic dizziness, because we already know that like the psychology behind it plays such a big part with chronic things. Like we know that it's things happening in the brain circuitry, that is making it chronic. So
mhm,
I would treat them more like people who are on your team supporting you, um, rather than maybe expecting them to like fix you.
mhm.
And like just keeping in mind, this is what I'd tell myself as well, but like dizziness is such a non-specific. So what I mean is like it's a symptom that could come with so many
Many
different
different
things.
things. Mhm,
Um, you know, like I guess just having that expectation that maybe like you won't be getting someone who's going to give you the answer. You have triple PD. I'm gonna do this for you. Like I would say, yeah, but I think you can still be frank and tell them like, be honest with what you're going through, and you could even like say this is what I think it's triple PD. If you haven't got that diagnosis or whatnot, but yeah, just utilizing them as like support, more of a support network. And yeah, physios do understand, like as I was saying, the biopsychosocial. So like maybe like taking more charge, and you can be like, hey, I want more confidence with. If you go see a physio, for example, I want more confidence with my balance,
Mhm.
and
Can we work
going
on
from
that? Yeah.
yeah, can we please like I feel dizzy, and I feel this worried, and XYZ, um, and taking charge,
Mhm.
rather than sort of going in and being like,
You must have all the answers, like,
yeah, yeah, yeah,
yeah.
because then I feel like, especially with triple PD, it's like not as known. You can come out feeling really like, I didn't get the answers I want. I
Mhm.
feel even more worried. So yeah, just taking a bit of charge and just focusing on what um, they can help you with. Like,
Mhm.
and that's a hard one because like I know what I can offer as a physio within my scope of practice, but I guess like other people might not. But yeah, like being aware that each health professional has their scope of practice, and they'll only be able to do so much within that scope of practice. This is an opinion I'm throwing in, but I'm hoping for better changes in the medical industry. Like I think they do well, but I think it can. There are areas of improvement, and that would be the holistic practice. So like integrating everything together, and which is why it's really good that the physio industry, like the education steering more towards accepting this
Biopsychosocial. Mhm.
biopsychosocial and being aware of that. And yeah, like for a physio, like we were trained to really be perceptive when that person needed to go see a psychologist.
Mhm.
You know what I mean? Or
Mhm.
for those psychosocial elements, or
Mhm.
like a counselor, things like that.
Yeah. So you're saying things are heading in that direction, but just for people who are kinda just entering, just be aware that not everyone has the same amount of training in it, and they can only help you with the things that they know you need help with. So if you
Yeah,
walk in a very passive way and say, "I'm dizzy, fix me, give me the exercises that are gonna fix me," and you're not taking into account that there are other things at play, and you're not letting them know that there are other things at play, then they can't help you with them.
yes, right,
Yeah.
right. Definitely.
Yeah.
And yeah, like basically you can you can take charge of your health, um, and use the health professionals as more like a support network.
Mhm.
Definitely, like that's a huge focus in physiotherapy. Is like we don't want from a health perspective, we don't want people to feel like they're lenient on us to be fixed. We want to. My goal is to empower the patient
Mhm.
so that they feel confident that they can manage their own condition
Mhm.
ultimately at the end of the day. If like this whole notion that I'm going to do some dry needling, he's going to be fixed. That's and this is controversial to all the physiotherapists out there, but
Yeah.
that's outdated evidence. It's not it's not the better way is the exercise, the psychosocial elements, the ability to self-manage your
Mhm.
condition, um, at the end of the day.
That's awesome. I hope people really take that message to heart. I mean, again, if they're on my channel, most likely they are gonna take that message to heart, but it's really good to hear that from you, from someone who's working with people in the field who are dealing with pain. It applies equally to pain. So,
Yeah,
that's really good advice. Thank you.
no worries.
Yeah. So I so appreciate you agreeing to do this and
Yeah,
helping me figure out the time zone and um, sharing so much of your story. I think people are really going to relate and really be able to listen to what you're saying because they know you've actually been through this stuff. So
yeah,
thank you so, so much, John, for doing this.
yeah. No
Yeah.
worries. Thanks for having me on. I really hope that yeah, what I've said can, resonate with someone out there or
Yeah.
people out there. Yeah, like I myself, I was passionate to do this and sort of like help out the channel because like the dizziness that was really scary for me, and
Yeah.
I just really want to I really feel for anyone who's going through something like this, and if there's anything that I've said that can help out in any way, maybe that's like more confidence from if you feel like you're falling or anything like that. Like hopefully this will help.
Yes. Yes, thank you. Thank you. And I'm always amazed by like how when someone's gone through this, how, you mentioned it's made you a better person in some ways, but like I think it really you kind of have to go through something like this in order to really get it when people go through this, like to have that compassion for people who are going
Yeah,
through something like this.
yeah. And
Yeah.
just to quickly add, like
Yeah.
the way I personally look at it, like in
Mhm.
the sort of modern society we live in, like stress is such a huge like impactor on health. And I'm at a fairly young age, and I've got a whole life to live ahead. And if I can build the tools to stay on top of my nervous system, keep it in check. Like we live stressful lives, like we do our 9 to 5 or whatever you got going on in life. And if I feel like I can be equipped, like your free course has really helped equip me with how to stay on top of my nervous system, keep my fight or flight in check, keep healthy. And so if I have to go through this for a year or however long it takes, but I can still do the things I need to in life,
Mhm.
then I'm fine with that. And that's not to say like going away from like that's not to say I don't have my days where I'm like, oh, like am I gonna heal anytime soon? Like that's
Mhm.
still there, but you know, I yeah, I'm okay with it. So yeah,
Yeah, it's kinda like, when you first start exercising, it doesn't feel good and you get really sore for a while, and then later on, like 10 years down the road, you're like, "Wow, I can climb that mountain," and people who are not doing this can't climb the mountain, right? I mean, it's kinda like
yeah,
that. You're conditioning your body, you're strengthening your body in an emotional way. I mean, not actually really
yeah,
in a physical way like exercise, but
yeah,
yeah. Well, awesome. Thank you so much, John. I'm gonna stop the stream, but you can hang in there for a couple minutes. We'll
okay,
chat.
yeah,
Okay.
okay, no worries.
All right.